Hello and welcome to another edition of Heart of Healthcare. My name is Dr. Jan Bonifer, and these podcasts are about helping physicians restore balance in their lives so we can create a medical system that benefits everyone. A quick reminder that you can find more information about our nonprofit heart-based medicine and the work we do to support healthcare professionals at heartbasedmedicine.org.
Welcome to the Heart of Healthcare Podcast Series 1, Episode 5. Challenging the stigmas around mental health issues for healthcare professionals.
There is still some stigma around mental health challenges in our profession. And as caregivers, we often expect ourselves to be superhuman and not to show any signs and symptoms that could be perceived as weakness. But caregivers need to be caretakers too. And prolonged exposure to long working hours, stress, and responsibility can leave us feeling overwhelmed and overburdened. When the cracks start to appear, are we getting better at taking care of our own needs and asking for help, or do we continue to struggle alone? In this week's podcast, we'd like to deepen our conversation to explore how, as physicians, we can practice better self-care. So please allow me to introduce my friends here for the second round on this topic, really taking a deep dive with Dr. Pete Turn and Dr. Daniel Dinnenberg. Hi again, Pete. Hi, Dan.
Hi, Jan.
Hey, Jan. Hey, Pete. Such a pleasure and honor to be back with y'all.
Great. Thanks for being back here. And we really started this conversation off in our last, getting together. And we wanted to take a bit of a deep dive today and see if we can really get to the real life experiences that we all have and that we had and that have become almost natural to us and natural to our trade. And one of the questions that we asked last time, whether this is really the kind of norm that we should accept, or maybe that we could question, and how we can handle this. So let's look at the first question, because the feelings of anxiety and overwhelm, that's something that we're all very familiar with. And some of us, certainly I have experienced burnout. And so if you have experienced any of those feelings, then I wonder if you could share your coping strategies that have worked for you as a healthcare professional, or that have worked for one of your colleagues. Dan, let's start with you today. Would you like to chime in on this?
Yeah, thank you so much, Jan. It's amazing when you talk to other professionals where, Jan, you just admit to kind of going through burnout, and it's something that we all know exists. And it's not something that's surprising. And it might be surprising to others outside the profession, but within the profession, it's something that we all deal with. I think for me, as you asked that question, the first thing that came up was that feeling of overwhelm. There wasn't a period that I remember that it was just, I was totally disconnected to medicine and completely burned out, but there was years where it was that slow burn of feeling like I'd see patients and give it my all day long. And then I'd have this transition moment where I'd come into my family life and I would do my very best for a very short period of time. But at some point, the patient encounters and realizing that I didn't chart on all of these patients and what I had to document and what I was left to do. And these things would just pop out at me while I was trying to engage in my home life. And it's so important to me. I'm someone that has, a deep, profound desire for presence and for engagement and for true flow state, and to understand that my profession was getting in the way of my enjoyment of these unbelievably beautiful children that I have, that I just get to experience. And that all of a sudden it's like, not remembering to chart something. And that overwhelm leads to a little bit of anger, leads to a little bit of the feeling of, kind of anxiety around like, well, how do I balance this? And that sort of that starts to kind of continue. And then there would be the, I'm sure all of us have dealt with this, but okay, great. After dinner, put the kids down. I think everyone else is watching some sort of Netflix or some show, and you're back to charting until very late. Meanwhile, telling my patients how the importance of sleep and the importance of engaging with the family and the importance of this downtime. And sure enough, now I'm dropping into a place where I'm not my best self. And so that's just painting the picture of the overwhelm that exists within medicine. Your question goes on to really ask, like, what are, what are the paths, what are the skills that I've developed? And when I mentioned the transition, I think that's where I ended up focusing my attention on, because I realized that when I'm moving from work into home life, there's a moment of entering the door. And so that's where the moment I would stop and I would take 3 big, deep cleansing breaths. So in through my nose, and just really connect deeply with that heart space. And so I'd bring awareness to where I was emotionally, and then I'd bring compassion for myself. And then I'd also kind of realize that I want to engage in a really powerful way with my family. And so I'd create a transition. So I think that the transitions like that really helped me. And that's where I would instill these tools that I've been using in my life. Another thing that is really interesting, and it's fun to share, but a bath, like something like that was nourishing, where I would set it up, where I would actually put in my Epsom salt and mix in my essential oils and set this bath up in a way. It's a very short amount of time, but it's like, this is what I need to transition from, okay, I did my work throughout the day, I got all the kids to sleep, and now I need to transition, boom, into a next level. So I really focused on integrating a lot of the skills that I love to utilize, whether it be my breath and my posture and my emotional shifting, but into these very key moments, Jan, where I knew that this is the moment that I need to transition. And then it put the charting and the feeling of overwhelm in perspective, and I was able to handle a little bit more throughout my day of how I wanted to go about things.
Thank you. Thank you. It's the overwhelm and the, if you like, disrespect for our own needs in the name of helping others. Huh? And then kind of finding a way to actually create transitions to really being home again and recharging.
Yeah.
So familiar. So familiar. Pete, how are you taking this?
I mean, it's so funny. Thanks, Jan. I mean, I think as a healthcare professional, I feel very fortunate to spend a lot of my time with a mild sense of anxiety, angst, and rising panic as my day progresses. And, I think for a long time in my career, I thought of this mild sense of anxiety as a bit of a superpower, or something that I maybe needed to make me a good GP, to make me, caring and compassionate, to make sure I didn't miss something. And I think as I've gone on, I realize I don't need to feel like that, or I shouldn't feel like that. I don't think it adds very much to my performance. And I think that, I'm a great believer in kind of actions and then, thoughts and feelings following on from that. And I loved what Dan said about transitions, because I've kind of written exactly the same thing. And there's a transition when you come home, which Dan has beautifully described. What I like to do is before I get in the car to come home, that's when I unlock my phone from the drawer. It's been put away, and I have a little binge on WhatsApp, and I see what my pals have been up to and some things on Instagram. And then I get in the car, and it's a bit of a kind of decompression chamber. I listen to a podcast, maybe like this, Jan, but I listen to something like Desert Island Discs. I used to consume news all the time and just be in receipt of angst about Brexit or the pandemic. And it doesn't need to be that. I now listen to Desert Island Discs or something. So I know very little about the pandemic, but I'm quite familiar with the early childhoods of a lot of minor celebrities from the 1980s. But I arrive home refreshed, take a breath as Dan does, and then I can be there properly for my family. And it goes the other way as well. I realized that when we go to work and I'm driving into work on a Monday and I'm feeling I'm feeling nervous about what's to come. If I'm the duty doctor, I'm always on call on Monday. So I'm going to be really busy, and I don't know how I'm going to cope. But I know that the first thing that I do when I walk into the door of the surgery is that I sit down with my colleagues and we have a coffee and we just chat about what we're, watching on TV. How's the weekend been? What are we up to? And that's just a little ritual that makes it so much softer a start into the day. I think the other things that running for me has always been a kind of Ctrl-Alt-Delete for me. I run feeling joyous and happy, and I run with a sense of kind of melancholy and sadness, but I've also run when I'm so frustrated and angry and sad. I run when I've missed a difficult diagnosis, and I've actually had tears running down my face, but I always feel better afterwards. And it's like sleep. It is just Ctrl-Alt-Delete. It just makes me feel something different. And I've started sometimes to, when it gets a little bit overwhelming at work, I might put on the running shoes. And I run wearing, chinos and my working shirt. And, I think colleagues would think I'm a bit odd and, look at the kind of list of things that I've got to do and think, why are you running? And I will point at the same list and say, well, that's exactly why I'm running. I just feel like I need to reset things. So they've been really important to me. And then I think the last thing that I really consciously try and do is to try and put a smile on. I think I can have a huge workload which I have very little control over, and I can either face that huffing and puffing and stomping around down the corridor, and all I'm doing is transmitting a sense of anxiety, or I can put on a smile and transmit some positivity and a feeling that it's going to be okay.
Thank you. The transitions are so important, huh? And particularly when we come from an emergency mode, huh? Like a day in emergency mode. Isn't that strange how this emergency mode, kind of this constant state of alert, is what creates a lot of this grind that Dan has described. It's not like this spectacular thing that happens and then suddenly we're burned out. It's more like gradually, it kind of sneaks in under your doorstep and you don't realize. It's like a very subtle change, and gradually your battery wanes. And we're building this idea, or I have certainly built this idea of, this is cool to overcome, as if I was thriving on depletion. That's what hit me like a sledgehammer at some point. So when I kind of rewind back to the first night shift, do you remember the first night shift that you had in hospital where you were alone? Like you're the one standing, everybody else is home, and here's this full ER, and there you go. It's your turn. And I remember this, and I remember the night before. And I didn't feel great, and I didn't sleep a lot. And I was thinking like, what should I read? Should I read this other chapter? And do I really have this down? And what happens if this happened? Am I ready? Am I prepared? And so there's this tension that you described, this constant tension. And then we start to learn to live in this mode of tension, and we start to learn to live. And at some point we feel like this is normal. That's the key thing to recognize. And for me, at some point when I realized, I have learned that a basic stress level is normal, and that's kind of what keeps me awake. That's what keeps me going. And it's kind of good to have a bit of stress, because then you're awake even when you're sleeping. All these little beliefs kind of trickle in. And what I forgot was this yummy feeling of not doing anything and just having that yummy feeling for no reason. So what children have, right? So that's what I'm trying to do ever since. Every morning is to set the tone of the day and see, can I get into this yummy feeling of just being, with no tension, with no expectation, with nothing that I have to perform. That really helps me kind of not go into a state of depletion during the day. So Well, thank you. So, we've shared some of our stories, and I guess we could go on and about it, but maybe you have witnessed a colleague of yours, or you have learned from a colleague of yours that they're struggling with either mental health challenges, or they're struggling with states of depletion, states of frustration, potentially depression, suicide. Colleagues really at the dire end of this spectrum. And I wonder if you had the possibility to interact with them, and whether you had the possibility to help them and be with them in that situation.
Yeah. Well, first of all, I love your description of, I think, it comes back to what Dan was saying about almost trying to achieve a flow state, doesn't it? And, I know that when I'm feeling good, I can spend a lot of time with patients, and I'm enjoying it, and I'm not really aware of time. And actually thinking about colleagues that have really struggled, I think one of the big indicators was that they were running too close to time. It was this sort of robotic, just, firing through patients really, really quickly. And we didn't notice for a good long time. And we found it really hard to raise the issue, to be honest. And we're lucky to be a teaching practice. So we have medical students and trainee doctors coming through the practice all the time. And I was thinking about how different it is dealing with trainees compared to colleagues who are struggling. And I think with trainees, there's this expectation that it's going to be hard, that they're going to need help, and we protect time for it. We have tutorials, we have debriefs, we have that really close mentoring relationship, and it just creates a space to talk about it. And with colleagues, it's so much harder. And I think it's because we don't have time for it, and it just impacts on our workload so much. But maybe more honestly than that, I think it's a fear of maybe what it tells us about ourselves. Because if I'm approaching a colleague and I can't find the time to do that, it's probably because I'm a bit afraid of my own workload. I haven't got the time to do it, and I'm worried about if he or she goes off, well, what's that going to mean to me? And it's just easier to ignore it and to keep peddling it. So I think it's about relationships. I think it's about creating a time and a space to have those conversations, and a culture where we acknowledge and expect us all to struggle, and just welcome the opportunity to talk about it.
Yeah, it's having the bandwidth to see. It's having the willingness to see in the colleague and also in ourselves. And then there's this stigma. So it's more difficult. I feel it's more difficult to raise these issues with a colleague than, with friends or with clients or patients. Somehow there's this stigma of, we're healthcare professionals, we're providing care, we're the givers, right? We're not the ones suffering. So it's kind of insulting, right? If you tell a giver that maybe they should take a little bit, there's this sense of kind of then we're kind of stating you have a weakness while you should be the strong one, right?
Yeah, and I think it's so much easier when it's a peer or a junior colleague, and so much harder when it's a more senior colleague, and you look to that person for guidance and to be a role model, and to approach that and say, are you okay? It can be really challenging and very challenging. I would have thought for them to accept it from a more junior colleague as well.
Dan, have you been in situations like this?
I have, Jan, and it's what comes to mind was I had this opportunity to share with. I created a resiliency program for colleagues, and I started with a deep listening practice, and taught the colleagues how I use to kind of get present in order to really listen. And so the first thing I did was I had everyone do like a 3-minute journey about getting clear about what their journey into medicine look like? The why. Ultimately anchoring into the why was this. And it was just so amazing, where just to give them a little bit of space and time to remember, oh, it was to be of service to community, to, my grandfather had this and I swore that this would never happen to anybody else. And just these really profound reasons for going into medicine. And then what I found was, in this deep listening, where all of the colleagues would then listen and then they would reflect back and this person would hear. And the reason that I share this as a skill that worked is I had one colleague in particular that comes to mind that later after this workshop was like, it was almost the aha moment that we've spoken about before. Was like, I forgot completely why I had gone into medicine in the first place. And I'm not doing any of that. And so when you guys are talking about, the robotic ability to stay on time, they sort of changed in their mind. To be a good physician is to do this, to chart and to see this number of people and to make whatever. And ultimately, the reason that they had gone in and they heard it for themselves and they reflected back from their colleagues was something totally different. And then using that skill of deep listening with their patients now is their opportunity to actually be there, to be there emotionally, to be there in connection, to just be a witness of a human being. And this is someone that said, look, you don't know this, but I was going to quit within 30 days. I was like, I had everything set up. I was going to change careers and, stayed with our practice for another 4 to 5 years and then ended up going on to run women's health, incredible, powerful initiative. And it just, not that I'm the one part of that, but it's a reminder that you see these successful things. And what did it take? It take just stopping and reconnecting for the reason and the purpose and the meaning behind what they're doing. And it allowed them to go away from the robotic and to really deep listening. And I think what probably happened, and you guys just spoke of this, Jan, this is your morning routine. You were saying that it's that transmission. Once they became someone that was actually in the room and actually present and listening to their patients, they became coherent. They became in this rhythm, and they probably were then getting all the subtle juju, for lack of a better term, of what it really feels like to connect with another human being and to be of service to them. And that actually spoke to their profound mission. And so that alignment, and I love your Ctrl-Alt-Del. I can start using that. But that transitional moment, that ability to, find decompression within the same setting that was causing the stress in the first place. So now maybe somebody could have this really emotional connection, and instead of being like, oh no, this person's becoming emotional. What if they cry? What if then it's going to take 7 more minutes? And then what if I'm late for the next? You're actually just present with it, and you're there because you're there, and you're actually open to it. And it's actually making you feel. And so the decompression is actually happening within your work, which is the transitions that we have an opportunity to do.
And don't you think, Dan, I love that. I mean, don't you think that that's why in the pandemic, it's I think burnout is going to be an increasing problem, because it's so much harder to connect with conversation when it's, maybe on the telephone first. I don't know if it's the same for you, but we're doing a lot of that initial, hearing the story on the phone, and you can try as much as you can to connect, but it's just not the same, comparing that to bringing somebody into the room and there's the eye contact and, just the touch on the shoulder and just that human connection that's really missing. And it becomes so much more of a cold transactional interaction, which is just kind of less nourishing for both the doctor and the physician, isn't it?
So much so. And it's amazing because even here we're your energy that you bring. I mean, it's like, I mean, what an honor to be a patient of yours. It's like you could feel the smile coming through your voice. And it's like, it's an amazing opportunity. So yes, it's just a phone call, but it's the beginning of that relationship. And ultimately, while I agree with that, this is our chance. It's our new challenge. How do you take the Pete hand on the shoulder and the sweetness that you have in the room and bring it into that new place for you, which is now you're not even seeing them and you just have to kind of like, make them laugh. And so it's a new challenge for you and myself to kind of bring that. And it's like, that's what kind of keeps it fresh, right? It's like, right when you got good at sort of knowing how to handle a patient and kind of make them feel, taken care of, now you have a different opportunity to do it. But yes, burnout's going to be bigger and we have to kind of like, start spreading that love all through medicine.
So we're already there in the middle of what is it that it takes to prevent burnout, and what is it that it takes to move out of burnout, and possibly also what is an alternative to martyrdom, that we've been all trained in, and what causes this stigma around mental health? What is it that drives us into this, and what makes it believe in these thought forms? So I wonder, is it presence? Is it loving attention to ourselves, to our patients? Is that really the key to overcoming martyrdom or not to even get into this pattern and to deal with mental health issues that are, as you said, Pete, increasing like crazy at the moment in this pandemic?
Yeah, it's like this martyrdom is like the kind of dark side of being altruistic, isn't it? We've got this population of high achieving, compassionate, caring individuals, and thrown together with a rising workload. The natural response is martyrdom, isn't it? And we celebrate it. And I have to be honest that we, having spoken about our surgery wellbeing hours, so last week, I'm so keen for this new iteration of these wellbeing hours to be a success that it's a sunny day and we sent off the staff for a walk and all of the doctors out for some sort of activity that made them feel good, whether it was running or some of them attacked the garden. And because the on-call doctors felt, worried that they were going to miss out on this opportunity, I said, well, I'll do it. I'll be the one in the surgery. I'll man the fort. And I sat there and I did everybody's special request prescription. I just had role modeled exactly what I didn't want to happen. And worse than that, when everyone came back, they hadn't even really noticed. I sort of, I kind of was a bit irritated and I was really upset with myself because I'd mucked up the opportunity and I'd wanted this, praise from my colleagues. And, I think, again, what I'm learning about myself is that we need to create a culture where we don't celebrate martyrdom. Yes. It's not an expectation. And so today, knowing that I was leaving work to do to have a conversation about martyrdom, I let everyone else have their special requests. I finished my left and I said, goodbye. I hope you're all out of here quickly. I'm going to go home.
Excellent. It's so interesting. We had a similar situation. We just introduced a new software in the practice. So it was a bit of a woohoo, topsy-turvy day with lots of surprises and that didn't really work the way we wanted. And oops, there's something else to be mindful of. And so sure enough, at the end of the day, we mismanaged time. And so Jessica was at home. She had an appointment and I promised to be at home at 7. So what happened is like at 6:30, we realized there's one doctor, there's no nurse, there's too many patients. We've we didn't have our act together. So I called Jessica and said, hey, I really need to stay here. I need to help. Okay. She said, no, you're needed here at home to help. It was like one of these climax moments where you say like, okay, so what is more important, helping in the family, bringing the kids to bed, or helping in the practice with the patients? And basically, I have created this reality. So to me, one of the first points to step out of martyrdom is to realize that I'm not the victim. I'm not the victim of the system. I'm not the victim of the patient having an emergency, or any emergency, in fact, but I'm the creator of this situation, and including my own kind of pleasure in being a martyr. And that really helps to change at this situation. That, okay, so I need to learn at a way more fundamental level, which is at the level that, can I actually stop creating a reality as a martyr? And rather than believing in its healthy defeat. So, whoa, we're really getting into it. We promised let's dive deep a little bit. So I think we did. Thanks a lot. Thanks a lot for sharing your stories. Dan, you want to add to this?
I just wanted to come back to that idea for a moment, because it's really important with martyrdom. When you spoke about that day in the hospital, that first night rounds, what came up for me as I remember, I had an advisor that said, and it was really important words, but he's like, look, the shoes of the physician, before you take off your shoes and get into that bed, make sure that everybody is taken care of. And I remember, it's so interesting because as you said that, I never took my shoes off. I just never got into the bed because there's always somebody that has issues. And it's like, that was ingrained in me, that was trained in me. And so that was the idea of the martyr to begin with. And I think that now, just kind of finishing that up, it's like the vulnerability and the sharing for me of like the truth of my own humanity is part of what helps me deal with that. Because the martyrdom led to me becoming self-righteous and angry because no one's seeing me. As Pete said, hey, no one even noticed. And then now it's like, look, this is how I show up and this is who I am. And that's kind of the helpful. And so can we bring that into medicine? Can we bring that feeling?
Dan, on that note, let's bring into medicine that we take our shoes off. So thanks for being on the show today. I hope you enjoyed that chat with Drs. Dan Dinenberg and Pete Chern. You can find more information at heartbasedmedicine.org. And I deeply appreciate if you could click subscribe on whatever platform you're listening to this podcast on. Until next time, folks, thanks for listening and take care.
This has been a Heart-Based Medicine production. Thanks for listening.